questions that you may have. We have our city manager, Rachel Smolinski, and our city clerk treasurer, Anna Soy. With that, Mayor?
Thank you, Chief. Thank you, media and department heads, for coming. Read our media brief here. It's very informative, and then turn it over to Chief and Rachel for any questions that you might have. So the City of Alpena is responding to the worldwide coronavirus 19 pandemic with a number of precautions recommended by state and federal officials to help prevent the spread of the virus and protect our citizens. It should be noted that there are no confirmed cases in northern Michigan at this time. There is no cause for panic, but it is wise to take steps to reduce the spread of the virus. With the declaration of the state of emergency by both the United States and the state of Michigan, additional resources will be made available to prevent, mitigate, respond to, and recover from this pandemic. The city has developed a safety plan for its staff, following CDC guidelines, disinfecting work areas, requiring that employees who become ill or need to care for family members who have contracted acute respiratory illness stay home, requiring frequent hand washing and good respiratory etiquette, and suspending business travel to areas where COVID-19 cases are confirmed are among the precautions being taken by the city staff. City-sponsored events where large crowds are expected will be assessed on a case-by-case basis, but will likely be canceled or postponed until the pandemic is stabilized. The city recommends that local groups planning such events follow CDC recommendations for social distancing. City police and city county firefighter paramedics have the appropriate personal protective equipment and training and will remain available throughout the pandemic. Contingency plans are in place to ensure essential services will remain available in the face of a higher employee absenteeism due to illness. Alpena County 911 dispatchers are screening callers to identify potential COVID-19 cases and alert incoming EMS personnel so the appropriate precautions can be taken. There are things that you can do to keep yourself and your family healthy. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when you are sick. Cover your cough or sneeze with a tissue, then throw the tissue in the trash. Clean and disinfect frequently touched objects and surfaces using regular household cleaning spray or wipes. Wash your hands often with soap and water for at least 20 seconds, or use hand sanitizer with at least 60% alcohol content. Follow public health advice regarding school closures, avoid crowds and other social distancing measures, and stay informed by checking official sources like the Centers for Disease Control and Michigan Department of Health and Human Services. If you are sick with the COVID-19 or suspect you are infected with the virus that causes COVID-19, follow the steps below to help prevent the disease from spreading to people in your home or community. Stay home except to get medical care. People who are mildly ill with COVID-19 are able to isolate at home during their illness. You should restrict activities outside your home except for getting medical care. Avoid public areas. Do not go to work, school, or public areas. Avoid public transportation. Avoid using public transportation or ride sharing or taxis. Stay away from others as much as possible. You should stay in a specific room and away from other people in your home. Also, you should use a separate bathroom if available. Limit contact with pets and animals. Call ahead before visiting your doctor. This will help the healthcare provider's office take steps to keep other people from getting infected or exposed. If you are sick, wear a mask when you are around other people. For example, sharing a room or a vehicle or pets before you enter a healthcare provider's office. Note all people with possible COVID-19 have severe difficulty breathing. If you do and need paramedic response, call 911 if you have a medical emergency. If possible, put on a face mask before the emergency medical services arrive. The City of Alpena is taking necessary precautions to minimize the impact of the coronavirus 19 pandemic on our community, and we ask the citizens to join us in taking the right steps to prevent or mitigate the risk in your homes and businesses. The people most at risk are our elderly, very young, and those battling other illnesses. While this is certainly not a time to panic, it is a time to be prepared, and we thank you for your attention. And I guess the only thing that I could add or reiterate, I suppose, from this information is to get your information from a reliable source, like the CDC, local news channels that you that you are familiar with, like those that are here, obviously, and those local, not necessarily social media news outlets that you can't identify that could be basically from anywhere passing any kind of information. So the CDC and your local news are the best sources of information. So with that, I'll turn it over to anyone that has questions. Yes, sir.
Can you just kind of talk more to those in Alpena that are probably watching tonight on really how you guys want to make sure people are prepared but not panicking, that they have no reason to panic right now?
Basically, just a reiteration of what I read.
Yeah.
Just the standard precautions for any illness, what you would do, but at a heightened. Normally you have people that don't feel so well, but they go to work anyhow. We should certainly avoid that and take this a little bit more seriously than the average cough or flu. But with that, I'll ask the chief if he's got anything to add.
Absolutely. The message is that this is not the end of the world. Everyone isn't gonna get sick. There aren't going to be a lot of deaths, but we don't want any. We don't want anyone seriously ill. We certainly don't want any deaths in Alpena. And much of that can be prevented by simply planning ahead, by taking the preventive steps that the mayor indicated. And we want to reassure our citizens that the city is on top and ahead of this. Rachel and I have been speaking for some time on it. The plan was going to have rolled out next week. Obviously, things moved along a little faster, and so we got together very early and got it all wrapped up so that we are 100% ahead of it. I believe that we've got an excellent team here. I think we have the training and the equipment and the supplies. We're working cooperatively with our partner agencies throughout northern Michigan. And I believe that we've got a good handle on this, and I want folks to feel confident in that. The number one message is that it can be prevented through social distancing, through appropriate disinfecting procedures and so forth. It isn't hard to protect yourself from it if we just do it first instead of last. The communities that are gonna run into problems are the ones that are waiting for a case in their city, and then all of a sudden they'll try and roll this out and it'll be too late, it'll already be going. So we're trying to be ahead of it. There are no cases in Alpena that we're aware of right now. We're hoping to keep it that way. Sir?
You had mentioned community partners. Give me an example of what community partners you're in touch with, and talk a little bit about public services like Thunder Bay Transportation, public transportation, and any steps that you've communicated with them to keep these fleets of buses safe and stuff like that.
Absolutely. Mark Hall, our Emergency Services Coordinator for Alpena County, is the primary point of contact for TBTA and agencies like that. And he's working with all of the different stakeholders in the community to make sure that they have the right information. Similarly, the city is also reaching out to those folks, and we're working with all of the Region 7 partners as far as other ambulance services, other hospitals, the long-term care facilities. There are a number of things happening throughout the community that are going to help to protect. For example, long-term care facilities at this point are taking the temperature of each of their employees before they clock in to make sure that the employees are not sick, because the elderly are so at risk. We really need to protect them. That's very important. Just an hour ago, I was on the phone with all of the hospitals and all of the ambulance providers in the northern lower peninsula, comparing what protocols we're using, what precautions we've taken, what are they doing in Traverse City, what are they doing in Petoskey, what are we doing in Alpena. And I was pleased to see that Alpena is ahead of much of the region at this point, and that's good. That's where we want to be, ahead of the curve instead of behind it.
I don't know how far preparedness is at this point in time in your world, so I don't know if this is a realistic question or not, but have you identified areas for quarantine areas, for example? Do you know if the hospital can handle a mass amount of patients? I mean, is it that far out? Is the planning that far out?
Yes, there are regional protocols for transporting patients back and forth and where to quarantine. Fortunately, most of these patients can be quarantined at home. We do have a contingency plan for quarantining employees at work if they get sick at work, because we can't send them home if they have people that aren't sick at home.
Right.
So we have our public safety facility, and we also partner with Presque Isle Township right now that gives us 2 stations that we could put people in if we had to. Because we can't have our paramedics who are sick because they were exposed at work going home and getting the rest of the family sick. Or heaven forbid if they had elderly folks at home, we certainly wouldn't want that. So we have those things in place if we need them. There are a number of contingency plans that we put in place. The city has some plans that we'll be going over after the conference with the employees that address the CDC requirements for if you do have an employee who is sick or they have a loved one who is sick at home, to take care of their sick time. If they don't have enough sick time on the books, we'll deal with that so that they are gone to take care of their family or to get better themselves before they come to work. We can't have them sick at work. FMLA kinds of issues, doctor's notes kinds of issues. One of the CDC recommendations is that we not require employees to go get doctor's notes to prove that they have COVID-19, because it puts them in a doctor's office where if they do have it, they're exposing other people, and if they don't have it, they might contract it. And so we don't want people to go to their doctor's offices or to the hospital unless they're very ill. It could be done, a lot of the things can be done at home. And home quarantine is one of the primary objectives rather than putting people in big groups. Again, through social distancing, they're recommending 6 feet around everyone to assure that if you don't have a 6-foot perimeter around you, that's too close. It's possible that you could contract from someone who was infected within that perimeter. So we'll be, as you see, the chairs here are farther apart today. We're trying to do everything that we can to assure that people don't contract the disease in that way. The latest on it, as of this afternoon, is that the medical community feels that it's primarily droplet transmitted. It's primarily droplets from sneezing or coughing, and those droplets going through the air and ending up in your mucous membrane, nose, mouth, whatever the case may be. And so the use of masks by people who are sick and by those who are caring for them will be a key component in stopping the spread.
Just one last follow-up question, specifically, what are EMTs doing at this point in time, since I'm assuming a great deal of your transports have to do with elderly people?
Mhm.
So what if anything, are EMTs doing specifically differently today than they were a month ago?
The 911 dispatchers are asking questions of the callers, advanced query questions, to identify if they have any of the red flags, if you will, for COVID-19. Have they been traveling in the affected areas? Have they been sick lately? Do they have a fever? Do they have respiratory difficulties? And then advising the responders, both the first responders and the paramedics, of that information. Based on that information, the first responders and paramedics are arriving with an N95 or N100 respirator on each of them, gowns, gloves, and a mask for the patient as well.
All of them, or just based on the call?
Based on the call.
Okay.
That's why the dispatchers are giving us that information up front. Also in high-risk facilities like long-term care facilities, we're masked and gowned anyway, even if that isn't a call, because there are so many people in a close area, and we wanna make sure not to cross-contaminate also.
Thank you.
No problem? Yes, sir.
Not sure if this is a question for you or not, but do you guys have tests readily available for people in Alpena if that is determined they need to take a test to determine if they have it or not?
No, tests are not widely available at this point. As I understand it, at this point, the hospital has to request that patients be tested by the health department. The health department has to send it to CDC, it takes a long time, and not everyone gets tested. However, the federal government is bolstering that up significantly, and by next week or the week after, there will be many more tests available. At this point, the doctors are eliminating everything else, and if it isn't anything else, and the patient's presenting with those symptoms, then they're presumed to have it. Yes, sir.
So we heard over the scanner last night, a woman called saying she came from Las Vegas and she thinks she was emitting signs of symptoms.
Mhm.
Do you have any information about what that call might have been about?
No, I can't really release any information on that, but we have no presumed or confirmed cases in Alpena. Anything else I can help you with? We certainly thank you for coming. Thank you, Mayor, and my colleagues for helping us put this on. The police are working great with us. We've got the masks, we've got everything we need, and we're here to help. Call us if you need us.
Thank you.
Thank you.
Thank you.